Good afternoon. It's a bittersweet time for me these past couple of weeks as I've seen my days narrow in terms of the time I've got left with the agency. I think everybody knows that I announced my plans to retire a few months ago, and the effective date is a week from today, my last day, with my retirement being effective September 1st. And it's been very bittersweet because it's been such an awesome privilege to spend these past 27 years with the agency and to work with so many gifted and committed and passionate individuals through the years. And I have a real sense of comfort in a lot of ways in terms of leaving the agency, and I'll get into a little bit of that in just a few minutes. But before I do that part of this last video conference that I'll have to spend some time with you, I wanted to go over a couple of other issues that are underway in the agency and hopefully help you to understand a little bit better some of the direction that we're undertaking. Probably first and foremost amongst those is our plan to move from our current public health areas to the districts. When you take Jefferson and Mobile as our two single county health departments out of the mix, the rest of the state has operated under 9 public health areas for many years now, and we are moving effective October 1st to a realigned geographic configuration, and the areas will now be districts going from 9 to 6. And I know that raises a lot of questions in terms of how we're going to transition and segue into that sort of new mix. And before I get into addressing some of those and reviewing them, I wanted to briefly revisit some of the information I've shared with you over previous satellite conferences, as well as routinely by both me and other staff at the administrative level with the leadership, the area administrators, and other area team members. And essentially the main question is, why are we doing this? And I think that part of the answer, a large part of the answer, is because it positions us as an agency to weather any financial storms that may unfold on the horizon, either near or long term. So that's probably the main reason that we started to explore a reorganization from a geographic standpoint in terms of trying to position the agency to move forward. And when you look at those challenges, they continue to unfold. We've had a number of considerations, and I've shared some of these before, but just to give you some of the highlights, for about 5 or 6 years now, we've seen consecutively, year in and year out, basically decreases in our general fund appropriation from the state legislature. And we've not been the only agency. It's not like they've selected us out just to bear the burden of that. State resources in terms of revenues have been stretched for many years now, and you see that play out on a lot of fronts. And certainly it's impacted us as an agency. And that has continued, as I said, over the past several years. The other thing that we're seeing is one of our key revenue sources, our clinic production, our clinic activity, has also seen decreases now for about 5 or 6 years. And those continue even into the current fiscal year. And they are cross-cutting with almost all clinic programs. None seem to have bucked those trends, so to speak. And that reflects some of the external factors that are basically competing for the same patients in terms of providing those services. And I'm going to not go through all the numbers there, but I would want to share, just to sort of make this real for you, the numbers in the family planning program. When you look at fiscal year 11 through 16, the decrease in family planning patients was just under 17%, and that represents about 14,448. Now, that was 11 to 16. When you look at the 9 months of fiscal year 17, our current fiscal year, we've continued to see that decrease in family planning patients almost at 1,998. So those numbers are still not leveling out and certainly not reversing. Patients drive visits, and in the family planning program, there's a multiplier of visits per patient when you do averages. So I'd like to also share with you the visit numbers for that same 11 to 16 fiscal year time frame. The visits decreased just under 33,000, and that is also about a 17% decrease. And again, looking at just this fiscal year, 6,300 decrease, again, just the first 9 months of fiscal year 17. So you can see that those trajectories, if they continue in those directions, are going to really challenge us from a financial standpoint. The Medicaid effort to move into regional care organizations is sort of homegrown managed care, as you know, just recently was taken off the table, and Medicaid's going to go in a little bit different direction. That actually gives a little bit of a relief to us in terms of our finances, because it means that they won't be moving into a fee-for-service model that will play out through regional care organizations, rather continue for the time being with the current reimbursement model. So for the services we provide, that's much more beneficial. So that was a little bit of a sigh of relief, even though we think the promise of RCOs probably would have done well around delivering services to the Medicaid residents, Medicaid eligible patients, but there were a host of other factors that sort of drove that decision. So again, in summary, as an example, family planning, the clinic production is one thing that challenges us in terms of looking out for how to best position the agency to move forward. And the other challenges there are some things that include the increase in health insurance that we have to bear. And for the agency on the employer side of that, we're seeing an increase of $2.6 million. And the cost for an EHR, not only in our clinic system, but also in our home health system, are additional multiple $1 million I guess, cost areas that we're also facing. And as you know, an electronic health record is really, at this day and time, a critical success factor in terms of ensuring the viability of our clinic operations. So when you add all of those and other challenges, we do bring back to the forefront the need to position ourselves with this realignment in a way that lets us be more agile and nimble to address these challenges over time. I would say that when you look at how that's going to unfold, one of the things that we've been mindful of is we need to do this in a way that's proactive and not reactive, that's planful and can be methodical and thought out and sort of unfold in a way that is as smooth as possible. And I think we've set things in motion to do it that way. What we are looking at, to get to some specifics, is at this juncture still being able to move through the realignment without any reductions in force secondary to that realignment. So we don't have any demotions or terminations in mind. There's not any list being constructed anywhere in terms of undertaking that process. However, you naturally are going to see, with the change from the 9 areas to 6 districts, places where they will be 2 of something, whether it's an area level position or otherwise. And we are working through having dual positions in those areas, and we'll take advantage of attrition, be it retirement or resignations over time, to adjust in those areas. What we ultimately are looking at doing is being able to reflect the demand for services through a staffing and production model that Ricky Elliott and other leadership have worked and continue to work on to say how many staff and how much clinic time, how many days should a clinic be open for a particular service, are right to meet the demand for the various services. And that's not an easy task. We have so many considerations in terms of trying to consider all the appropriate factors in getting that to a point where it's a useful tool, but I think that we've made a lot of progress and are well down that pathway, because at the end of the day, that's going to inform how we are right-sized, if you will, over time relative to the demand for our services, and give us the opportunity to sort of move in that direction. What's going to happen that's tied hand in hand with that is that we'll no longer have county-level positions and area-level positions. Those will be folded into a district position, so to speak. So you won't have county registers and area registers. Folks will go into a district pool, and no one's going to lose seniority as we move from areas to districts. What it does mean for the individual employee who will maintain their seniority and their classification is that you might be in a larger pool, and it will give management the flexibility over time as demand shifts from perhaps one county to another in different ways to assign staff to work where the demand is. And that's the whole premise on why we need to move forward with that aspect of moving to the districts. But again, no employee is going to lose their seniority or time in service, things of that nature, but they will be in a larger pool, if you will, which can be helpful in certain circumstances. What folks have also asked about is the basing. Individuals will not see a change in their base relative to the realignment going from areas to districts. However, over time, based on the demand for services, clearly it's inappropriate to maintain a certain level of staff in a given location if the demand for the services doesn't exist there. So there may be a change in base over time as we work through the staffing and production model and need to reflect staffing with the actual demand. So I hope that that's helpful in some ways with kind of fleshing out some of these key questions that are coming up around the transition from the areas to the districts. Now, practically, that has some implications for the month or two around the actual change, October 1st, and I want to share a few of those with you just so you can be mindful of these. And they really have to do with working registers and hiring staff, filling vacancies. And because we're using different codes in the districts as we move from area and county codes, there needs to be sort of a timeout period, if you will, prior to getting what would now in the future be a district register to fill a particular position. So for those folks that have outstanding registers that are either county or area level positions, those need to be returned to HR, to Human Resources, no later than the 1st of September. And the appointment dates don't need to exceed September 16th or 18th. According to Brent Hatcher, there can't be any October 1st or 2nd appointments as you return them. So that's kind of the sequencing with that process in terms of handling the registers when you're filling a vacancy. At the end of the day, you won't be able to have any registers out for area or county org codes after September 1st. If you're not able to kind of move that process forward and make that appointment by September 16th or 18th, then we're asking that you return the register on the 1st, and that would be without an appointment. And then you'll have to wait until the district registers are available with the new district org codes, request another one, and then start the process with that new district register in hand. So that's sort of some of the overview of how we're going to transition and close out using area and county registers and move towards the district registers, with there being sort of a, what I would call a blackout period, for lack of a better word. And certainly HR is prepared to answer and has been answering questions around specific issues, but in general, those are the ways that we will handle that part of the transition. So I wanted to shift a little bit away from that, which I think is the major thing that's on most folks' minds, certainly since October 1 is getting right around the corner, and move to a couple of comments about my plans to retire. And I opened by saying that was a really bittersweet time for me, and not an easy decision to make, but became one that when you make it, and for those of you that have experienced it with someone or personally or whatever, many of you will kind of relate to what I'm fixing to share, but once you made the decision, you just get a sense of peace about it, and you realize it's the right thing to do. And I think that it's been very comforting for me from a lot of standpoints. One, I think the agency is in a good place, and we're never going to be without challenges. We're never going to be without things on the horizon and bumps in the road. But what we've done historically has been able to go over around those bumps in one way or another, and we'll continue to do that, because I think, frankly, our mission is noble, and at the end of the day, that's to make this a better place to live for everybody that lives in this state. And we do it through a variety of programs, but they all end up being around quality of life with a focus on health. And I want to take that opportunity, recognizing that mission, to say how gratifying it's been to work with a team of folks, and I'm talking about almost 3,000 employees, and those who have left already, throughout the years. And as you get more time, you see more folks that, remember when so-and-so was here, and you have these memories and whatnot. But I really do count as one of the highlights of my life, having been able to work with so many absolutely awesome folks who have given their all to this job. And I want to tell you how much I appreciate that. And that's not to say we all get along with each other, but I think I've challenged myself, and I would challenge each of you to continue to try to put yourself in the other person's shoes, whether it's a coworker, whether it's somebody coming to you for services, somebody that acts up in the family planning clinic, or doesn't think you're treating them right when you're doing whatever program you're working in. At the end of the day, to try to get into their shoes and appreciate what may have led them to that point where you're interfacing with them. And it ain't always easy. I continually challenge myself on that front, but I think being mindful of that has helped to hopefully make me a better person and to model some behaviors. And it's not easy. I still struggle with it. I struggle with it with my wife and my daughters and so on. And but I challenge you to do that, because it's getting to be a lot more complicated world with social media and instant this and instant that. So I think to try to hit the pause button where you can, walk just a few steps in the other person's shoes. I think that helps all of us, and it'll continue to help us as a team doing the work of the agency. So again, to thank each and every one of the folks that I've had the privilege to work with is something that I can't do often enough and profoundly enough. I wish I could do that with every single one of the 3,000 of you, but I can't. But just know that I hold you in such high esteem, and frankly, you're a big part of the reason that I've been able to do this job, and I'm so proud of this agency. And I would also share with you what a privilege in general it's been to be your state health officer, to follow in Dr. Williamson's shoes, to count him as a friend and a mentor, to count many of you as friends and mentors, is again a part of me just really appreciating the blessings that I've had. The last thing that I would say in this transition is another real sense of comfort that I've had has been that Dr. Harris, Scott Harris, is going to follow as acting state health officer. And I think many of you are aware of that, if not all of you, but the board did appoint him in that capacity, I guess meeting before last, and so he will be taking up the reins. He's been down here for a couple of days a week, 2 to 3 days a week over the past couple of months, and we've been trying, to get him kind of acclimated and oriented and exposed, but that's a endless effort because there's always something else to be done. So that checklist will never get completely done, and it may not, Dr. Harris, even when you're here, 10, 20 years from now. So, but I do want to say that is a a sense of comfort to me that I know that someone who's going to take up the reins is somebody that I think is very qualified and has certainly the passion and the commitment to do so. And I'll share with you, the board discussed the notion of appointing a search committee to identify a permanent candidate, and that direction they are discussing and may undertake, and certainly Dr. Harris will be applying if it unfolds in that way. But for now, as acting state health officer, I think he's going to do a good job. And with that, I would like to ask you, Dr. Harris, if you would go ahead and come up here, and I'm going to do what Dr. Williamson did almost 2 years ago. It was a little less planned. I was sitting out there in the audience, and we hadn't talked about it ahead of time, and he just said, "All right, I think it's your turn," and started taking his mic off. Well, we've got Dr. Harris mic'd up separately to make a couple of remarks. But again, I just want to say thank you to each and every one of you, and it's been an awesome privilege. I'm still in Prattville. I'm still going to be around. I hope to see some of you from time to time, and I'll forever be seeing you in my mind and my heart. So, Dr. Harris. It was.
Thank you very much. If you work in a clinic or in a hospital or in healthcare, you really have a chance to touch people in a way that you just almost can't in any other walk of life. It's really an honor to do that, and I've just felt that even more so much after coming into ADPH. I just feel like it's such an opportunity to magnify that and to reach out and just do good things, and really, ultimately, we're here to just take care of other folks around us, to take care of our friends and loved ones and people in our community and people in our state, and that's really what we're about. And so I'm really honored to do that. I do want to try to remember what the mission is. I had to go memorize it before I came down for this, just to be sure, because I'm not sure which is the mission and which is the values and which is what. But we're really here to promote, protect, and improve the health of the citizens and communities of Alabama. That's really what we're all about, and so I'm just honored that I can be part of that. And then the final thing I'll say is I just want to say thank you again to Dr. Miller. Thank you so much for your leadership. Thank you for mentoring me these last few months especially, but even before. I just appreciate who you are as a person. I appreciate your commitment to public health. I appreciate how you care about everybody. It's just been an honor to work with you and get to know you, and hope you know I'll be calling you a lot. And that's all I have to say. Thank you very much.
So here's your water. All right, so are we done? Who's our cruise director?
Unless you open it up for questions.
Okay, questions. Does anybody have any questions? Okay, it's a quiet group. Well,
Questions at all?
yeah, again, thank you very much. So I guess we're done.